People hear about the need to so-called strengthen their pelvic floor, but in fact, many people need to do the exact opposite. Today, you'll learn about that. You will also learn about sexual health as it relates to erectile function, as it relates to things like vaginal lubrication, as it relates to orgasm. For instance, that many people believe that hormones are responsible for sexual dysfunction, but in reality, hormone dysregulation is responsible for only a very small percentage of sexual dysfunction, and yet pelvic floor and blood flow related issues can account for a large number of cases of sexual dysfunction in both males and females. So I assure you that today's discussion is going to illuminate many new areas of information, many new tools and protocols that I'm guessing most people have not heard of. We talk about the neural, vascular, that is blood flow related, and muscular aspects of bladder function, prostate function, Skene's glands. We talk about vaginal health as well as penile health. We talk about these things as it relates to different stages across the lifespan. It is a far-reaching and in-depth and practical conversation that I'm certain everyone will glean important takeaways from. Now, before we go any further, I do want to highlight that the content of today's episode is sexual in nature. We talk very directly about different types of sexual behavior. And we talk about it from the standpoint of the clinician and biologist. So it is a medical/scientific discussion. That said, we can't be aware of where this podcast is being played and who is listening. And I assert that there are certain themes within today's discussion that would not be suitable for young children. How young? Well, that is certainly not for us to discern. We realize that different parents and different households should be the arbiters of what sorts of information their children are exposed to or not. So my suggestion would be that if you have any concern whatsoever that the content of today's episode would not be appropriate to be heard by some member of your family, that you please listen to the podcast first, or at least check the timestamps where we've detailed what specific topics are covered, and then to make your decision accordingly. I should mention that not only is Dr. Malik still an active clinician, she sees patients daily out of her clinic in Southern California, and we provided a link to that clinic in the show note captions. She's also authored dozens of high-quality peer-reviewed publications in the fields of urology, pelvic health, and sexual health. And we've also provided a link to that bibliography in the show note captions. And she is also a spectacular public educator. She provides zero-cost content about sexual health, pelvic floor health, and urology as it relates to both men and women on her YouTube channel.